Fine, thanks very much indeed, Tony. I'm not actually going to give a presentation as such. I want to leave plenty of time for questions and answers. But Margaret asked me to talk a little bit about partly about the importance of patients in getting drugs into countries, and also a little bit about the essential medicines list. Before the medicines patent pool, I ran an umbrella organization, I think a bit like yours, a bit like IPWSO, called the World Hepatitis Alliance, that had patient groups as members from across the world. And we were actually trying to get hepatitis more universally known and prioritized, particularly at WHO. And what we did to do that was work essentially with countries and find countries who could champion things for us. And the patient voice was absolutely critical in making that happen. But in terms of rare diseases, it's somewhat trickier. I mean, our model at the Medicines Patent Pool is about persuading pharmaceutical companies that have a new patented drug to give us a license so that we can get generic companies to make it much more cheaply, because they're not recovering the cost of research, and they tend to have much more efficient production methods too, because particularly for orphan diseases, where the prices are going to be very high, there's no particular incentive for pharma companies to lower the cost of production, because whether the cost of a drug is $100 or $500 doesn't matter if they're selling it at 25,000, because the markup is so big. But on the other hand, if you're actually looking to try and get drugs at affordable prices in LMICs, then it becomes really important. So that's kind of our model. But the problem with our model is that it's sort of based on the big volume, low price, rather than rare diseases. And it's interesting because when we talk to governments, they very often put rare diseases at the top of their list of what they would like generic products for, because of the costs and how much a single treatment can, or a single disease treatment can upset their budgets. I mean, it's great. I don't know much about your disease area, but it's great that you actually have a drug now potentially. And the question is, how do you get that into countries? Obviously, I mean, you just heard from the EMA, the company needs to go and register. Although, having said which, there are some platforms that I believe, if they have registration from a stringent regulatory authority like the EMA or the US FDA, countries may be able to order direct. There's something called the IDA Foundation, for example, who does this. And this may involve waivers. It will depend on individual countries, how they're set up. But that may be a way of getting originator product into a country without the originator having to go and do the individual registering country by country. There is also the EMA actually has a process for registering in low and middle income countries, as does Swissmedic. But in both cases, I believe I'm right in saying it needs to be registered either with the EMA or Swissmedic first. But clearly, the interaction between you and the company is what's really going to make this happen, I would suggest. the pricing model is clearly going to be something that you're going to have to work on. And there are moves to, well, let me just stick for a moment with the registration. There is these reliance mechanisms whereby a regulator will rely on another regulator's approval already, and therefore significantly shorten it, is really spreading enormously. So that's really helpful. But what was I going to say? Yes, the other thing that is really happening a lot now, it's still, I would say, fairly in its formative periods, except in some areas, is pooled procurement. And that can make a big difference in terms of pricing and the willingness of companies to actually do something. If they start thinking they're not going to have to do a lot of individual A, registration, and B, sales, that it's going to be pooled. So PAHO, the Pan American Health Organization, the sort of American part of WHO, although they're independent, has led the way for many years in doing this. But now Africa is going to set up their own pool procurement. As you know, they're setting up the African Medicines Agency as well. So that again, with help with registration. But my personal experience is that you can have very good relations with companies as the kind of voice of the patients, and they particularly like it if it's sort of centralized, like you seem to be. I managed to have very good relations with all the pharma companies that were involved in hepatitis when I was doing that, but able to have very frank conversations with them. And because that's really important too. But I think that's an important way to go. And then I'll just finish on the EML and then open to questions. So with the EML, it's interesting because some companies are very keen to get their medicines onto the essential medicines list, and some are very keen not to have it on the essential medicines list because they feel that they are then under pressure to make it more widely available. So it would depend on the company. As you probably know, it's a 2-year cycle. They open it to applications about 9 months before. There's an applications form that's available from the EML site that's very clear about what you need to put in there to make an application. But it's really important to engage with both the EML team at WHO and the disease team. Now, you will not have a disease team at WHO, unfortunately, at the moment. Everything's being slashed there, and B, the NCD department is desperately understaffed. However, unless you come under some other bit of WHO, which I don't know whether you do, but those are really important if you're going to try and apply for the inclusion in the EML. And then when they close the application and consider it, and then they reopen their proposals for inclusion for consultation, and that is a really critical point at which patient input is really, really important. So if you can get it to that stage where it's open for consultation, that's really, really useful because they open and put a lot of things that may or may not actually end up on the list. So that's just a quick overview there. So I just wanted to keep this brief, and please feel free to ask me any questions.